Welcome to our pamphlet series.
This video will expand upon the information on the pamphlets.
You can find these pamphlets in different clinics around town, and also you can download it from the description of the video below us. Hi Jude.
Hi.
So in this video we're going to talk about knee osteoarthritis. This is just a model of the knee, it's not a real knee, just a model. And we're going to talk about the condition that is known as knee osteoarthritis. Can you explain a bit about this condition?
Yes. So knee osteoarthritis, it happens when here at the ends of the joints there is a cartilage. When this cartilage starts to wear out and you're starting to get the situation of bone on bone instead of cartilage on cartilage, then that's when you get pain, disability, and what we call knee osteoarthritis.
Now, in many cases, I must say about knee osteoarthritis that my patient, some of them treated as they got a death sentence.
Right.
And it's so far to be in the case because I have patients with knee osteoarthritis that are walking, hiking, running even. That's a very common myth. If I have knee osteoarthritis, I'm not allowed to run.
That's right.
Actually, the recent research showed that it's not that it's only not causing damage, it can also help to improve your condition.
Yes.
As long as it's done in appropriate loads and gradually. So knee osteoarthritis, it's true that it's unreversible condition, but it's highly manageable condition, which means that even with a very severe osteoarthritis, you can still live a very happy, proactive life.
That's right. With the good guidance, for example, physiotherapy, exercise, physiologist, but just don't despair, all right? Now, what are the symptoms of an acute episode of knee OA?
Exactly, the key word is episode. As in opposed to most of the other pamphlets that we have in this series, knee osteoarthritis is not something that you go to sleep at night and then the next day you have knee osteoarthritis. It's a condition that develops gradually and slowly over a course of years upon years. During this course we have some period when the patient doesn't have any pain, which is most of the time, or have very minimal pain, and we also have times of flare-ups. So in these flare-ups that can last from a few days to a couple of weeks, we will usually try to control the pain and control the swelling. The knee is getting swollen sometime in these cases. For some patient, heat is very beneficial. I find in the flare-ups that cold is probably a bit better. I would try cold first, but it's not allowed to put heat on it. To control the movement, to take anti-inflammatory if you prescribe some by your doctor, to try and reduce the activity level in these flare-ups. But the most important thing is what you do between the flare-ups, and you can talk a bit about it.
Right, so this is something you could wear in between your flare-ups, or even when you do get a flare-up, you could wear this, and you could wear some kind of compression and a compression sock underneath. So this will help decompress the joint. So like we said, the joint is very compressed. There's a bone-on-bone situation going on. This brace is supposed to decompress the joint to give you a bit of relief. So these are one of the things we could do. Obviously, we could also do some physiotherapy.
Of course,
so guided exercise program to guide and to lead you on how much loading you want to do on the joint. We want to load the joint, but we want to do it progressively and intelligently.
Specifically in osteoarthritis of the knee, I think that the fear is a very big component of the problem. People are afraid to do. I had some patient in the past that they were serious hiker, and once they done an x-ray and they found out that they have osteoarthritis, they stop all the activity. There isn't any reason to really stop it. We have to control it, we have to manage it. We can't solve it, but we can manage it in a very, very good and effective way. But in this case, it's really changing your lifestyle. For example, there are some research out there that show that losing 10% of your weight will reduce 50% of your pain. So it's also something worth to consider. If you are overweight, not exercising, changing in lifestyle can save you from more serious treatment, or another line of treatment that exists in case that physio didn't work or can work very nicely together with physio is, for example, a Synvisc injection, which is, maybe you can say a few words about this.
Yes, so the Synvisc injection is basically injecting a kind of gel in between the joint, and this gel acts as a pillow. So again, the joint is very close together, rubbing. This pillow will act as basically as decreasing the friction between both joints, and usually it helps. It lasts for about 6 months, and you could do it up to 3 times. Another type of treatment is PRP, where they take some of your platelets in your blood cells, they do some mechanism of centrifuging, and then they re-inject it in your joint. That is actually today, I was speaking to a physiatrist the other day, and he told me that is the better choice between Synvisc and PRP. But again, each body reacts differently. At least you have different options.
Yeah, but one key aspect in all of these treatments, on its own, it's pretty worthless. It have to come with change of lifestyle, with physical activity. You know, it's like someone is doing a surgery and expect that everything will be fixed. That's not the way. We always need to accompany it by exercising and changing our lifestyle.
Absolutely. Now, obviously, you have the end of the road where you've tried everything and there's just too much degeneration in the joint, where you need a total knee replacement. These are quite successful, again, depending on your activity level before the surgery and your activity level after the surgery. So you got to be ready for that surgery. You got to look at your weight, you got to look at your exercise level and your techniques, and a lot of either physical activity, or you got to be related very closely to a physiotherapist that will guide you pre-op and post-op.
Yeah, that's really, as you said, the end of the road. There are some knee exercises that you can find in our website, in our YouTube channel, in our Facebook page. So there are a lot of resources out there to help you to deal with it. Honestly, I find that in osteoarthritis of the knee, physiotherapy is one of the most efficient things that you can do. And in many cases, it doesn't require very long treatment. It just requires some guidance, helping get rid of pain, get rid of fears, and then you're good to go and to do a lot more activities. So I will definitely try to recommend, if you have osteoarthritis of the knee, I will definitely try to recommend consult a physiotherapy sooner better than later. Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.